Welcome to Mind and Molecule, the podcast that untangle the complex relationship between pharmacologies and behavioral health. I'm your host, Sheow Yun Sie. Today, we are focusing on a critical medication in both neurology and primary care, Levetiracetam, widely known by its brand name Keppra. The second generation anti-seizure medication is a powerhouse, but its unique benefit and specific risks demand close, integrated care. Our discussion today focuses on the behavioral health mandate this drug creates for every provider. Levetiracetam works differently from older anti-seizure drugs. Instead of just targeting inhibitory channel, its main action is on a protein called SV2A, which helps regulate neurotransmitter release in the brain. By moderating this release, it helps stabilize excessive electrical activity. Its application is wide. It's used for acute seizure emergency and for long-term chronic management. Because of its effectiveness and rapid application, it is a preferred non-sedating second-line choice for the urgent conditions of status epilepticus. Furthermore, its use had expanded into prophylaxis, meaning preventing seizure in high-risk situations like following a traumatic brain injury. This is the key selling points for provider, especially in primary care. Pharmacokinetic simplicity. Levetiracetam has a favorable profile concerning interactions with other medication. How? It is minimally metabolized by the liver major drug processing system. Most older anti-seizure medication interfere with this system, forcing risky dose adjustment for drugs like antidepressant, antipsychotics, or common heart and cholesterol medication. Levetiracetam largely avoid this issue. Therefore, Levetiracetam is often the first choice for complex patients, making it highly relevant to integrated behavioral health services. If a patient has epilepsy is being treated for depressions or a psychotic disorder, this drug minimizes the risk of metabolic interaction with their psychotropic regimen. But the benefit of metabolic simplicity comes with a significant caution. Real-world analysis reveal a major risk: neuropsychiatric side effect. When researchers investigate the FDA adverse event reporting system, they found that psychiatric disorders were among the two most common reported side effects. The symptoms most frequently observed are changes in mood and behavior, including becoming more easily upset, aggression, anxiety, and the emergence of depressive symptoms. This means the clinical challenge shifts. Since levetiracetam avoid metabolic interfere, the risk move to pharmacodynamic interactions. When this drug is combined with other psychotropic medication, the concurrent use increase the risk for overlapping central nervous system side effects, such as excessive sedations or exacerbated agitation. This risk of adverse event can lead to poor adherence and negatively impact both physical and mental health outcomes. Given this risk, active collaboration with behavioral health provider is non-negotiable. The behavioral health specialist is crucial for two monitoring actions. First, proactive screening. We must implement protocol to look for subtle mood changes immediately after this drug is started or the dose is adjusted. Second, they assist with challenging tasks of differential diagnosis. Considering a complex case, a child with both autism spectrum disorder and epilepsy, the drug is chosen for its minimal metabolic risk, a major plus for a child likely on multiple medication. However, if the child becomes aggressive, is that the drug behavioral side effect, or is it part of underlying neurotype? The behavioral health specialist expertise is required to accurately distinguish this issue and guide interventions. If a patient is struggling, remember there are alternatives. Research suggests that switching to a related drug, Levetiracetam, can often help patients who experience these dose-limiting psychiatric effects. Levetiracetam's story is one of dualities. It is an essential treatment, valued for its unique mechanism and unparalleled pharmacokinetic simplicity. This feature make it a strong candidate for patients with highly complex medical and psychiatric needs. However, the real-world data forces to confront its other face, the significant potential for neuropsychiatric side effects. The very reason we select this drug, its minimal hepatic metabolism, is the feature that ultimately shifts our clinical focus. It's a clear behavioral health mandate. We must incorporate thorough, explicit screening and monitoring procedure into every clinical pathway. We cannot be careless simply because the metabolic profile is clean. The integrated care model is not just ideal here, it is essential. It is only through the close collaboration of the prescriber and the behavioral health specialist that we can harness Levetiracetam's medical elegance while ensuring our patients are protected from its behavioral risks. Thank you for joining me on Mind and Molecule. The journey of drug review reminds us that the best patient care happens when we look beyond the molecules and work together to manage the entire person. You can find all the studies and resources that inform this review on my final reference slide. Until next time, stay vigilant and stay integrated.